Hi, welcome to the presentation on functional communication training, an overview for direct care staff. Before we begin, let's go through some of the learning objectives. We hope that by the end of this presentation, you will be able to provide an overview of functional communication training, also known as FCT. We hope that you understand the importance of FCT as well as being able to identify learners that would benefit from FCT. We hope that you would understand the ABCs of behavior and to gain an understanding of the functions of behavior and know the steps for implementation. So what is functional communication training? FCT is a procedure that utilizes differential reinforcement to teach an alternative response that serves the same purpose or class of reinforcement identified as maintaining the interfering behavior. FCT is used to teach a new communicative behavior that replaces the interfering behavior. Interfering behaviors can come in many shapes and forms, but some examples include screaming, crying, running away from the instructor, flopping to the ground, self-injurious behaviors, and aggression towards others. This new communicative behavior is called a replacement behavior. So why is FCT important? Well, FCT is important for many reasons. Most behavior is the result of an individual trying to communicate something. FCT enables individuals to communicate their needs and wants in an appropriate way. Many parents seek services for their children based primarily on problem behaviors, and challenging behaviors can be a big barrier for individuals with developmental delays as it negatively impacts on learning. Further, highlighting the importance of FCT. So where and with whom should FCT be used? Well, FCT can be used with individuals with autism, traumatic brain injury, attention deficit disorders, attention deficit hyperactive disorders, and with individuals with speech and language delays. FCT can be implemented within multiple environments, such as the home, school, and clinic, and by multiple people, therapists, family members, and teachers. FCT can be used with vocal and non-vocal learners. Before we look at the implementation process, let's talk about the ABCs of behavior. When we refer to the ABCs of behavior, what we're talking about is the A for antecedent, B for behavior, and C for consequence. In relation to antecedent, what we're looking at is what is happening in the environment right before the interfering behavior occurs. When we talk about behavior, what we're talking about is what exactly is the behavior and what does it look like. Consequences refer to what happens immediately following the behavior. Before implementing FCT, it is important that we identify the function of the interfering behavior. When we're talking about function, what we mean is the reason or the why of the behavior. There are many different functions of behaviors, and here are the most common ones: escape, avoidance, attention, access to tangibles, and sensory. The following video illustrates how FCT was effective when implemented with a young girl with autism named Brittany.
I want to talk to you about how to reduce problem behavior in persons with autism and developmental disabilities, and how to replace their problem behavior with more appropriate responses. A large percentage of persons with developmental disabilities and autism tend to engage in high rates of problem behavior, and therefore skills and knowledge about how to reduce those problem behaviors are crucial for appropriate family life and overall functioning of the individual. Let's do this puzzle. Over the past 30 years, the field of applied behavior analysis has researched rather extensively the issue of problem behavior reduction and replacement. A large large body of research now exists on how to reduce interfering behaviors to their lowest levels, resulting in a more positive outcome for the family and the individual. Techniques most often used to reduce problem behavior are first to conduct a functional assessment of the problem behavior. In other words, discover the triggers or the reasons for the problem behavior, and then to teach individuals to replace those problem behaviors with effective and positive methods of intervention. Take these out for morning. Take them out for me. Take them out. Good. That's the way to do it. Parents frequently feel as though the problem behaviors of their children are not easily reduced and are a lifelong problem. Our research shows that with effective techniques and appropriate methodologies, many of these problem behaviors can be reduced to very low levels, resulting in a happier, more productive life for the child and the family.
What color is the paper? Purple. Very good. What color is the block? Yellow. And what color is the cup? Red. Very good. Which one? I want both.
Now it's time to discuss the steps for implementation. Prior to implementing FCT, it's important to identify the interfering behavior and complete a functional behavior assessment. Identify a replacement behavior that is most appropriate, and then you can begin collecting data. Create opportunities for the behavior to occur and make sure you plan for opportunities for generalization across the multiple environments and people as previously outlined. Prompt the learner to use the replacement behavior, but do not reinforce the interfering behavior. Only provide reinforcement when the replacement behavior occurs. Make sure you shape the response and fade the use of prompts. Use progressive time delay to delay the delivery of reinforcement and monitor progress. We hope that this presentation has enhanced your overall understanding of SCT, and if you do have any questions, please don't hesitate to ask any of the supervisors here at the clinic.